Hello, and welcome to the 5 Second Rule podcast. I am welcome to the 5 Second Rule podcast. I am Jess Fargher, and my preferred pronouns are she, her.
And I'm Kelly Holmes. My preferred pronouns are also she, her. Today, we're diving into a topic that's been widely discussed, from healthcare to dining room tables, vaccines. So vaccines continue to play a critical role in preventing disease and also protecting our communities. But it's also a subject that has been of heated debate lately and raises a lot of questions. So to help explore the science, address concerns, and talk through what infection prevention professionals should know, we're joined by a special guest, Dr. Demetre Daskalakis.
And in this episode, I will be referring to him as Dr. Demetre. And he'll be discussing our current vaccine conversations, the role of vaccination in the IP world, and how healthcare professionals can navigate these discussions with our patients and colleagues. Before we dig in, let me introduce you to Dr. Demetre. Okay, super duper impressive background. I just have to say, a little daunting. But I'm super excited you're here. He is nationally recognized physician and public health leader in infectious diseases and emergency response. He received his BA from Columbia, his MD from NYU, his MPH from Harvard, and then followed his advanced training at the Harvard's Beth Israel Deacons and Partners Healthcare. Dr. Demetre is currently serving as the Chief Medical Officer of Callen-Lorde Community Health Center in New York City, a leader in the LGBTQ+ health locally and nationally. Prior to his role, he has held major leadership roles at the New York City Department of Health, overseeing HIV, TB, STD, immunization, and laboratory programs, and has been managing responses to measles, Legionella, and New York City's initial COVID-19 outbreak. But I'm not done, people. At the CDC, he also directed the Division of HIV Prevention and later led the National Center for Immunization and Respiratory Diseases, where he managed strategies for influenza, COVID-19, RSV, and the transition of the U.S. COVID-19 vaccine program to commercialization. He has played a critical role in national response to respiratory virus threats and managed high-profile outbreaks, including measles and avian influenza. He has been demonstrating trauma-informed leadership during challenging events like the August 2025 CDC shooting. As Deputy Coordinator of the White House National Mpox Response, Dr. Demetre's innovative approaches led to a dramatic reduction in daily cases. Throughout his career, he has championed health equity, LGBTQ+ health, advanced-based policy, shaping the national and global strategies in HIV prevention and vaccination. Anyways, welcome.
Thank you. That is that introduction made me tired. My goodness, done a lot of things.
You've done a lot.
Yeah.
Been to a lot of places, seemingly.
Oh, it's so great to have you on the show with us today. Thank you for taking the time out of your busy schedule to give us some of your perspective and pearls of wisdom. So to start us off, can you help listeners understand the current landscape of vaccine recommendations in the U.S. and then what changes are shaping the conversation right now?
Yeah, I think that if you had to pick one word to describe the current landscape of vaccine recommendations in the U.S., I think you'd probably have to call it chaotic. I think that we have sort of the traditional way the vaccine recommendations are usually made, which is through the Advisory Committee on Immunization Practices, which I know we're probably going to talk a bit about at some point. That has been fraught in the last year because the panel had been replaced. Seemingly initially, the people that I knew were really well-esteemed vaccine experts, and they were replaced with folks who were at best vaccine skeptics, which we all are actually, but more likely people who held a very anti-vaccine perspective. The result has been some strange convenings. I assume that there will be more strange convenings. Some releases of vaccine schedules for the country that usually took a lot of methodological review and scientific process, some willy-nilly releases that didn't sort of go through the normal scientific process, really then prompting major organizations to say that they don't have faith in the vaccine policy of the country and instead are doing their own thing by really focusing on science rather than ideology. So I think right now we're in kind of a weird place where like the normal way that we used to do vaccine policy and vaccine recommendations is one that many people doubt. Many states are completely ignoring the recommendations that were made that were made by HHS through just posting a new schedule without having any discussion. And so I think it means for people, for medical providers, for folks in infection control and prevention, confusion. And that's, I think, where we are.
Oof. First off, I just have to say, it is tiring. And I'm sure it is tiring on your end as well. But from your perspective, what do you think the biggest concerns are, or possibly the unintended consequences of these recent changes?
Yeah, I mean, my biggest concern, so, I'm going to put my doctor hat on, my medical provider hat on and say that here I go, the hat is on. When medical folk are confused, or when the patients are confused, sometimes the result is inaction. And so I think that, just the first step is by being confused, I think that folks don't know what advice to give. And that may mean that they're not giving advice, which may then mean that there will be people who will be less likely to hear about vaccines, to have the conversations, and potentially to vaccinate their children or themselves. I think that the other potential consequence of all of this confusion, which is, I think, one that we're living, is that, our normal source of good public health guidance, the CDC, is no longer such a source. And so I think that, there's been a lot of conversation now for 5 or 6 years about, there's the impact of the pandemic on the trust of CDC or towards CDC. And I think, recent data actually show that since, this more aggressive health regime's taken over, the trust in the CDC has gone even lower. And folks are really focused on trusted sources, like their professional organizations, and then, thank goodness, their primary care providers. So I think that we're in an interesting space where, as that chaos and confusion continues to fester, I think we're in a place where people are going to have to look to their providers, their medical doctors, and their professionals for the source. And I think what I'm worried about is the moment when there isn't 100% alignment between medical organizations, people will be, I think, really confused. So I think right now we're fine because, I think everyone is seemingly aligned, but, there may be new products that come, there may be new things that need to be thought about. And there's no guarantee that everyone's going to be in perfect alignment without in the vacuum created by the lack of federal leadership.
Well, I don't think there's ever been an alignment in the first place. So now it's become even harder. And then patients have had to advocate, but now looking to it's so confusing. So I'm happy that you're on here today because us IPs and other listeners have at least this as a good resource to come to.
Oh, good. Yeah, no, I'm so grateful that I'm on. It's a good conversation. It's not an easy one, but I think it's really important for folks to know, that it's trauma-informed care. It's okay to be confused right now because it's meant to confuse you. And so, having such spaces to talk about it, I think, is really important.
Yes. And I feel like the changes have happened dramatically over the last year. Like if you miss 2 weeks of the news, like there's a whole new, story that's out there, and it's, making my head spin. And it's really scary. Like you said, inaction is, most likely going to occur, and people may stop getting some of those vaccines that are recommended. So from an infection prevention perspective, we are going to probably see a lot more of these communicable diseases walking through the doors. So, you mentioned that professional organizations are publishing their own immunization schedules. So again, what challenges can arise when different groups issue this different guidance, when parents go to, doctors with their children, and should I get vaccinated? Should I not? What are they going to follow, and who do we trust?
Yeah, I mean, I think right now the good news is that many of these organizations, at least from the perspective of immunizations, are fairly aligned. But I do think that, there's going to be a moment where people are going to review data, have a different perspective based on the populations that they serve, where all of a sudden there may be different recommendations from different organizations. And I think, that's going to be hard. And I think that it's going to be a pretty significant challenge for like the normal person on the street to say, do I listen to this internal medicine doctor or this pediatrician or this public health person? So I think that, that's the challenge. And I think that the solution is now more than ever, where there, I think sometimes is an alignment to really work together across the professional organizations to try our best to align. Because we owe it to the people that we serve. And remember, like so many of these organizations they serve the people, they serve providers and other professionals whose job is to look after the health of people. And so the mission is not necessarily to like have, perfect harmony, but it is to remember that really trying to align as best we can is important so that we can execute on the mission, which is to make sure that people stay healthy.
Absolutely. Absolutely. Do you think that the American Academy of Pediatrics will continue to recommend more vaccines than what the federal regulation schedule is going to look like?
Yeah, I mean, I think that, the thing that's really interesting, I'm going to take a step back on that one, which is that, seemingly the way that the press has covered it, it's that that the federal government has decreased the number of vaccines that are recommended. What they did was use jargon that people don't really understand to say that some of them are shared clinical decision-making vaccines, which are, by the way, still recommended vaccines. So I think that there's a kind of an illusion that there's been like a big thing that's happened. I think that some of the things that, we will likely talk about some of the things that are bigger, but I think that the big move that they made was really not much of a move, except to sort of demonstrate that they said they were going to do something and they did it. So at the end of the day, like those vaccines are still recommended. Does it create chaos and confusion? Yes. Does it impact things like insurance coverage? Actually, no, because they didn't make that big of a change. And so, that may not be forever, but I do think that, the AAP, the Academy of Pediatrics, I think are looking at the totality of the data, which is more than I can say for the folks that released the schedule from HHS.
And okay. So a little bit about me. I had a son in December. So the first doctor's appointment. Thank you so much. He's my second little boy. And all of these changes came out. First thing my pediatrician says is, please stay off of Google. And I'm going to tell you, we're staying with our recommendations, what we did with your first son. I go, absolutely. And you were saying everything's in chaos. IP runs on chaos, but being a mother to a new child is even more chaotic. And then to come out and be like, oh, there's this and this and this. So let's talk about the Hep B birth dose, because
sure,
I just, the risk of delaying it or missing it, you already have all of these thoughts of what's going to harm my child, what's going to help my child. So this is a conversation, I think, not only for infection preventionists, but mothers out there as well.
Yeah, I mean, I think that the hepatitis B birth dose is one of the examples of data and process not being used to make a decision. So maybe like a good thing to do is to talk about what would normally happen if there were a public health problem that needed to be discussed in the sort of space of vaccine policy. So the very first step is there a public health problem? So I'll start by saying there is no public health problem that would have triggered a change in the hepatitis B birth dose, right? The vaccine is very well tolerated. It has literally made hepatitis B infection in young children nearly unheard of in the United States, except for rare occasion. So the first question is, why was there even a need to sort of think about it again, since nothing has really changed? There is no new data. There is no new science. There was just some inspiration to try to, make good on a promise of trying to reduce the number of doses of vaccine at birth. At the end of the day, hepatitis B, infection is not something that causes a lot of trouble at the beginning of life, but a very high percent, like up to 90% of kids who get infected with hepatitis B at that point in their lives will go on to have chronic hepatitis B, and about a quarter of them will have an early death in the future as adults because of the fact that they either get liver cancer, liver failure, or one of a host of other hepatitis B related issues.
Shut the front door.
Right. So the sort of vaccine policy in the United States has been that if you're able to prevent an infectious disease with such consequences with a vaccine that is well tolerated and that has not a lot of side effects, then we should do it. So this is like a kind of change where the idea is, well, not everybody that has hepatitis B. It's not such a common infection, so therefore it's okay to let a couple kids slip by, which has not been the policy of the United States ever. Like, our goal is like the moonshot of eliminating these preventable diseases, so no child grows up to be an adult who needs a liver transplant.
Right.
So that's the hepatitis B story. There's a lot of jargon, a lot of fake news, really, saying that we shouldn't vaccinate newborns if the mother, the pregnant person is not hepatitis B positive. And what they forget is that 11% of kids that are diagnosed with hepatitis B later in life don't have a mother who is positive for hepatitis B infection, but instead had an exposure likely related to a caregiver that caused the transmission. And so by vaccinating, and we also don't have this like amazingly perfect system where every pregnant person gets all the prenatal care and all the vaccines and all of the things. We don't have a system that perfectly tests everybody. And so our vaccine strategy for hepatitis B was, the vaccine is so well tolerated, if you vaccinate all kids, you're doing them a favor in the future of their lives, because maybe they will be exposed. It gets taken off the table. But then also, like, there is a inherent risk in a non-universal healthcare system that we're going to have someone who falls through the cracks. And the vaccine addresses the crack, so that kid doesn't need a liver transplant 25 years later.
Exactly. One of the things that a mother has brought to me before, she was concerned because she was like, well, kids get the hepatitis B birth dose in the hospital, but then when you go to your pediatrician at that, 2-month visit, then they start it over again, the 3-shot series. And so is my child getting too many doses of the hepatitis B vaccine? But what I'm hearing you say is that that's safe, and that, almost that third or fourth dose then is acting as a booster, really, but it's completely harmless.
Yeah. I mean, there's all of the evidence does not support that there's anything with the vaccine that the risk benefit ratio has shifted in a way where a change of policy is required. Like, we know that, the risk of the infection is so great, even though it's potentially like a rarer event. It's not necessarily a rare event that a child is going to be in childcare and be exposed to someone who may not know their hepatitis B status. So in countries where they actually defer the hepatitis B birth dose, most of them have universal health care and really good policies for parental leave and really good policies for sick leave. We don't have that. And so I would be really, I know, shocking. I would be really happy to negotiate and say, I would be willing to say that there's no benefit of the birth dose if then in exchange I get universal health care for the United States. I don't think that's going to happen. So I do think that the birth dose is really important, given that we know the science and the epidemiology support giving it.
Absolutely. And yeah, then the lack of follow-up for the full shot series later on in life, right?
Yeah. Kids that get that first shot finish the series. And the other thing is, remember, like, think about that 2-month visit. Do they give you like a separate hepatitis B shot, or do they give you combination vaccines so the kids get fewer shots?
Combination.
Number 2.
It was 3 shots.
Correct.
Oh, go ahead. Sorry.
No, go ahead. You just did this. You can speak to it in great detail.
Which I do want to correct myself. I said all mothers, all caregivers have that thought in their head of taking care of their child. But it was a combo, which made me feel better because and all of the information up front and to give me that reassurance. My pediatrician is amazing about that and talks to me about the why. And so I'm hoping all caregivers get that information up front. It might not happen, but having that understanding of this is what could happen really made me think, okay, yep, I trust you. Do I love hearing my child scream? No, but he calms down after a minute and it saves him in the long run. Anyways.
Yeah. I mean, and I think that's, shout out to all the pediatricians. Their job has just gotten so much harder because they always have conversations with parents around vaccine. And, folks have implied that they've not been having these conversations and they've not given sort of parents the ability to discuss whether or not to vaccinate their child. And that's not what the pediatricians I know, like one of their favorite things to do is to talk about vaccines and to teach parents about why vaccines are so important. So I think that, you're just reinforcing, I think that's something so important, which is that they do live for this. It was easier. I mean, my cousin gave birth at the end of December and I got the phone call, what should I do with the vaccines? And, I played coy and said, what did your pediatrician say? And literally, Jess, they said exactly the same words to her, which is like, we recommend exactly what we've recommended for a long time now and really hope that you're not looking at things that are misleading you into thinking that this is not a good plan.
Please don't use ChatGPT to make your decisions. Go talk to your pediatrician.
Yes. Okay, let's switch topics slightly to measles. So, of course, we saw a lot of measles last year in the United States, and then we're continuing to see an increase in measles cases this year. So we know that measles is one of those notifiable conditions that are reportable in every single state, but it's not necessarily reportable when someone is hospitalized with measles. I know that it's best practice to go ahead and report that. But, those numbers could, people that are hospitalized with measles, it could possibly be underreported. So how do you think that quality of evidence might, change people's perceived risks or their decisions about vaccines?
Yeah, I mean, so I think one of the core features of public health is that you need good data to be able to have visibility into what's happening with infectious diseases. And if that at all falters and you get something that's either misleading or potentially even incorrect. So measles also gets reported through the lab. So if there is actually a lab-based test that's done, that also goes through public health and then theoretically will then triggers a local investigation. So I mean, the more complicated issue is what happens when people decide not to come to care when they have measles. And I think that is for me an even bigger concern, because I think that there are some fail-safes in the data reporting universe for diseases that would allow you to catch those cases so that the public health investigations and response can happen. But I do worry, especially having seen it firsthand on the ground, that the bigger concern is that, kids will have measles and will stay at home, and, then we won't have the visibility into the fact that there's more cases. And, the CDC recently, this last year, implemented wastewater testing for measles. And It's really interesting, very interesting. Sometimes, like for some things that we do wastewater testing, I kind of wonder if it tells us anything. So for instance, like they do wastewater testing for flu. By the time it's in the wastewater, we know that people have flu. The hospitals start to get busy. The ERs get busy. So it doesn't tell us very much. Measles, on the other hand, it's kind of like, I think it's a helpful tool because you all of a sudden will see there's measles wastewater positivity before you hear or see anything about cases. Because remember, there's the prodrome. So like, it's a very interesting like use of the wastewater. And then sometimes there are jurisdictions where we don't hear anything about a measles case, but the wastewater is positive. Could it be someone passing through the airport, which has its own thing to talk about? Like, great. Or is it that, it's not the vaccine strains of measles. They actually use an assay that differentiates vaccine strain from wild type. So that wastewater stuff really tells us that there may be more cases than we're seeing.
Mm-hmm. I've heard that some jurisdictions are, cutting their funding for wastewater testing. Have you heard anything about that?
No, I sure have. I mean, I think that it's interesting. There's a lot of conversation about how important wastewater is, but nobody wants to pay for it. And so it's a really interesting circumstance where like we seemingly use it all the time. And then like, there's not resources that flow. So I think that, in a universe of limited resources, I think that there are some places that are thinking about limiting that technology. And like I said, I think that there's a lot of things that we do it for because we can, right? We love to flex our science muscle and say, look, we can test for everything. But, there's like, COVID is another example. Like I always look at the COVID wastewater and I go, okay, I'm not sure what that adds to my life because I know other ways that there's increasing COVID. But for measles and for Mpox and for all of that other stuff, I think that that it definitely has a clear benefit.
Absolutely.
I think a lot of listeners are going to agree with one of the statements you said. And because IP, I feel like, is all about preventing infection prevention, yet that funding is like, oh, it's gone away. And you're like, but we're here to prevent. And so many of these amazing tools we have access to are like, but who's going to pay for it? Which I, again, could think of another episode. So maybe we just have you come back and we can all spill the tea about that.
Well, let's do a shout out to infection prevention, right? Like it's so hard because people only know about the work that you do when something goes wrong.
Right.
Like, so you're like, oh, there was an infection control failure, like blah, blah, blah. And so I feel like that's why this is like so great because we should be talking about all the things that we prevent every day. That the kids that were in the hospital with the case of measles that didn't get exposed because there's like engineering controls, administrative controls, and vaccination, like all the things that infection prevention practitioners do to make sure that they stay healthy. I mean, like, I remember when I was at the Department of Health in New York City, I got deployed to the hospital in New York, where the individual who has Ebola was admitted, and like you've never seen more people love infection prevent. Well, of course it is, because it's like infection control extreme.
I did a GIS.
Anyways, it is the most amazing, like, yellow, green, red zone of like exposure. And it's got all the things that you all like live for. And like literally like that became the center of attention. And so I think that, people forget that there's that sort of crisis amnesia cycle. But I think that like the more we can talk about what you do every day, whether it's measles or Ebola or flu, it doesn't matter. Like that work is so important. And, just like the rest of public health, things that you prevent, people don't see and they don't think that there's anything going on. And so rather than be self-effacing, I think we need to talk about what we do every day and the things that we have prevented. So anyway, big shout out.
No, so you've already kind of gone into my next question for you, because it's so important about educating and communicating, and not everyone can get on a podcast or have like a TV show. So what role can clinicians and public health professionals play into communicating the vaccine science when there is so much misinformation out there?
Yeah,
Do you have the
I have
solid
so
answer
much.
for us?
Right, here it goes. Just get ready. So I feel like my perspective really is that that interaction between the people that we serve, the people that we care for, and the folks providing that care or service is like one of the most sacred. And so what I think our job is in public health as well as in healthcare is to really stick to the science. And I think that there's a fearlessness that comes with that I think we should all relish, which is that, just like my cousin and just like you, Jess, like when your pediatrician talked to you, like, there's a moment of like, am I like treading on this person's politics? Am I doing something that's going to be controversial? And the clinician and the public health practitioner needs to sort of say, here's the deal. This is the science. I'm happy to talk about it. But I think that probably the biggest call to action is don't give up. I think that that's one of the things, like in all of this chaos and all of the noise, it's really easy just to sort of throw your hands up and say, I'm not going to have the conversation because it's going to not go anywhere, or I'm scared to have the conversation. And I think that the real answer is like, the reason that we're all in this is that we have a fearlessness about us to make sure that we tell people the truth as we know it and as we understand it, and be willing to sort of answer hard questions. So I think that for people, whether it's infection prevention practitioners or frontline clinicians, it's don't give up. We've always done the right thing, and we should continue doing the right thing because that's what will maintain the trust with the people that we take care of.
So for anyone watching, come closer. Don't give up.
Don't give up. Really?
I think we have a hard battle ahead of us, in the years to come. I'm reading this book for a class that I'm in. It's a health policy book. And there's a study in there that was cited that, says that misinformation spreads faster than true information. And so here we are, in a world of TikTok and Instagram and Facebook and everybody's opinions out there. And so I think we do need to be careful, of all the misinformation. So for the people out there who are experiencing vaccine hesitancy or maybe questioning what they thought they knew, with some of these really good arguments that you see about misinformation, what advice do you have to them? Where do you recommend that they go for accurate information?
Not shockingly. And I know that this is hard because not everybody has a doctor or a practitioner. You should talk to your primary care person if you have one. And if you don't, my advice is to try to get one. And if you don't, so for the folks in our universe here that we don't have a perfect healthcare system, we have a lot of fragmentation, more and more people who are veering toward not having insurance and not being able to have a practitioner or a provider or a doctor. I would say that you should then look at the organizations that represent those doctors and then also your local public health department. So I think that sort of in the chaos that we have in the federal system, I am always very inspired by the local jurisdictions that are anchors that continue to sort of ground themselves in what they know. And so I think that that's my advice, which is, if you have a doctor or someone else who looks after your care, pharmacists as well, there's a whole list of practitioners, and we can say NPs, PAs, it just goes on and on and on. We know that they're the most trusted, and so they're most trusted for a reason. And so I would rely on them.
I love that.
And the other thing is, one more thing important is on misinformation, and this is for the providers, and like whether it's infection protection or like healthcare directly, primary care kind of stuff, the best vaccine against misinformation is science. And so I think that if anything happens out of all of the craziness that we're living through, it's to really encourage people to just like have good conversations with your patients about the things that are important, because that in effect pre-bunks a lot of the misinformation. And it's a vaccine. It protects you against misinformation. It's really hard to treat misinformation, but it's easier to prevent it if you actually start by having like really good conversations with your patients before the noise hits them.
Love
love
that.
that.
That's great advice. Yeah.
So you've
And it's
kind of
evidence-based. That's the data. The data for misinformation is pre-bunk it. Pre-bunk that. Do it
Pre-bunk
before.
it. Okay.
pre-bunk it. Prevention of pre-bunk. Blah, 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 blah. I feel like that could be a tongue twister.
Pre-bunkification. I don't know.
Yes.
It's a word now.
So you've already kind of answered my next question. It's the data. It's the science that helps you. But while you're swimming through all of that chaos, because I feel like that's your everyday job, what gives you that optimism about the future of vaccines? What is keeping you going besides that science?
There's so much stuff still coming. Like that, I think is probably, I think that even though there's sort of been like this attack on science and this attack on research, there's so many new technologies that I think are bubbling up that are going to like change the game. And so whether it's, an immunization that we think of to prevent an infectious disease or a vaccine against like a chronic condition, I think that, not shockingly, the thing I'm the most excited about is that the science keeps moving forward. And I think that we're going to be able to protect people against more and more infections and potentially lots of other things because that technology is like moving forward. So try to keep science down, it tends to keep moving. And I think that that's probably the most exciting thing. And then I've got a second part, which is like, I'm okay with us having to become better communicators. I feel like very often when you look in medicine and in science, you have people who are just fabulous scientists and like not so great communicators. Like we need to value communication and communication abilities in our scientists because it changes the game.
Absolutely. I love that. That gives me hope. Yeah.
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 It's good, right? It's good.
Yeah.
Like new skills, everybody.
Okay, we're going to switch to something fun. Not that this hasn't been fun.
I thought the whole thing was fun.
I know, me too. Me too.
What?
Okay, we're going to treat you to a lightning round. Okay, you ready?
I'm ready.
Okay, coffee or tea?
Coffee.
Yes. Amen. Morning person or night owl?
Both.
What?
Are you like
I'm
me,
good
like
at
the
both.
2
I love
a.m.
both.
to... Oh, okay. Well, never mind. I thought we had a connection right
I can
there.
stay up
2
late and
a.m.
be happy. I can wake up early and be happy. It's like I can do either both. Like I don't have a preference.
Wow.
Both.
Yeah, you are pretty amazing. You've accomplished a lot. So you don't strike me as the type that sleeps very much.
I like it, but I don't need it.
Okay, sweet or savory?
100% sweet. The biggest
Yes.
sweet tooth in the world.
Okay.
Yes, you're in good company here.
Yeah, what are we getting together?
Yeah. Like let's go to some dessert place. I'm ready to go.
I love it.
Okay.
Okay, Jess, I'm going to let you go next.
Yep. So I was indifferent on this one, but podcast or playlist?
Playlists.
Does your playlist
What's your
I like
genre?
podcasts. You know what? Listen, no offense. Yeah, they sometimes do. But like I'm like more of like a music entertainment guy and then like occasional podcasts. Like so I'm more likely to turn on like a music playlist than to turn on a podcast. But I do like a podcast. But if you had to tell me I'm on a desert island, it's either playlist or podcast, I'm gonna pick playlist because of variety.
What's your favorite genre? What's your go-to? Listen.
I'm a really big Madonna fan.
Yes.
So I'm really excited that there's new Madonna music coming. So like that's, so everything emanates from there.
Amazing.
Yeah.
Okay. All right. So this one was thrown on here, and I'm very curious about it. New York City or Washington, D.C.?
Okay. So I was born in DC and I lived in
Okay.
New York for a very long time and I just moved back. So I feel like however I answer this question, I will somehow be in deep trouble.
You're going to upset somebody.
And the answer is New York City.
All right. Okay.
Yeah, once
Wait,
it gets
were
into
you
your blood. Yeah, I've heard.
were you in New York City the entire time, or
Yeah.
were you? Okay. Oh well, whatever.
No, I grew up in DC and so I lived in New York forever, went to Boston for a few years, back to New York, back to Atlanta, or then to Atlanta. And now I'm firmly in New York City and will need to be removed with a shoehorn.
Okay, East Coast guy. East Coast all
guy.
the way. All
Up
right.
and down, up and
All
down.
right.
I think I already know the answer to this next one, but for background noise, silence or music?
Silence. Is that shocking?
No, I am shocked.
You would think
Is
it's
it
music, but
because
if I need to
you already have so much going on up there that you're like, that fills the sound?
A little calm around tends to be the thing I need to be able to do the things I have to do. So I do like some silence. I like music for other things, but for background noise, my preference is none.
Wow.
Who knew?
My mom used to say the
now we
same
know.
thing. She said it was because us kids were so loud. Yeah, but I get it.
Okay.
Well, Dr. Demetre, thank you so much for being on the show with us today. You've really given us a lot of good information and then left us with hope. So I appreciate your time.
Thanks for having me. Nice to see you, Kelly and Jess. That was really fun.
Oh, see,
Have a great rest of your day.
You too. That's great.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.